and income improvement programs such as NRLM, National Rural Livelihood Mission. If they are properly implemented, and marginalized groups may emerge as pressure groups, which may lead to socially just society. What seems to be feasible in India is an incremental approach to improve the living conditions of the vulnerable groups. Thank you.
Thank you, sir, for throwing light on some crucial statistics that need immediate attention of experts across social sectors. Discussions and seminars like these will surely serve as stepping stones towards improving rankings of Indian society in Wellbeing Index by providing innovative solutions to overcome existing social sector issues.
May I request Dr. Lakshmi to get the book on SLPs in India released. The IPE is the only institute in India which has all the data on state level public enterprises. We have many agencies doing research on central public enterprises, but this is the only institute, and Dr. Lakshmi and the team has been working in these areas. I think we had a wonderful address, which brought about so many things, about deprivation, poverty, social indifference. So thank you very much, sir, for very, very interesting talk. I request now Professor Mahendra Dev to kindly speak on a very important theme. And I personally believe one thing: if you can create employment, one person in a family, that will transform our country. We have done everything, but we have not created employment. I often say, sir, that we are producing, as Professor Radhakrishnan told, we are producing engineers. Now these engineers, they can make machines. But if you don't give them employment, instead of machines, I think they'll take guns into their hand, and things will happen.
Dr. R.K. Mishra, Sri Surendra Mohan, Professor Radhakrishna, Professor Banoji Rao, Padma Shri Suman Sahai, Sri Kaundinya, Ms. Soma De Selva, Professor Sai Kumar, Dr. Anand, Dr. Lakshmi Kumar, and friends. I am very happy to be here in IPE. I have seen under Dr. R.K. Mishra how IPE has grown. When I was in CESS, Hyderabad also I have seen. And we have 27 ICSSR institutes in India. I think he is one of the dynamic directors of one of the ICSSR institutes. Professor Radhakrishna has given an overview of the social sector development and the human well-being. And he also mentioned that it's a two-way link between social sector and growth. Because without growth, social sector cannot also improve because you need expenditure. And without social sector, growth cannot improve. Recently, I've written on malnutrition. If you ignore malnutrition and hunger, it will cost the economy 3% of GDP, 3 to 4% of GDP. So it's a two-way relationship, and he has given the overview of the thing. But now I am going to concentrate in the next 20 minutes about one of the important schemes, the Mahatma Gandhi National Rural Employment Guarantee Act. This is not going to solve the entire problems of social sector, but this is one of the ways to improve the social sector. So it cannot do miracles alone, but it is one of the important things of social sector development. If you see the public works programs, over the experience in several parts of the world, in fact, India, of course, started very early. Even in the 1960s, it started. You see the importance of the rural public works programs. It can even, people like Ragnar Narkse said we should use this for capital formation. At global level, even countries like Ethiopia, African countries, many other countries have used these public works programs. But India is a pioneer in these things. It started, of course, in 1960. The next important one is the Employment Guarantee Scheme of Maharashtra, which I've written many papers, as Dr. Mishra mentioned. And then we have, of course, at the national level, JRY and other programs. But the most important, of course, is the Rural Employment Guarantee Act, Mahatma Gandhi, which was introduced in 2006-7. So we have 7 to 8 years experience of this scheme. So what is the contribution of this NREGA to social sector development? That's what the organizers wanted me to speak. And first, how is it different from other schemes, earlier schemes? It introduced a rights-based framework, because JRY and all was not a rights-based one. It's the first time we have rights-based one. And also it incentivizes states, because employment is 100% is given by the center and 75% material cost are done by the center. And also integrated with natural resource management, because the water conservation and soil conservation, that kind of measures. And resources are transferred directly to the states based on demand, not like earlier, it's not some formula you give the funds. And also gram panchayats are involved in this. And another important is the social audit accountability, which Andhra Pradesh is a pioneer in this, the combined Andhra Pradesh that time. And also the report is presented to Parliament and state legislature, the NREGA one. And next one is, which I have documented recently, is there are 10 direct and indirect benefits due to NREGA, MG NREGA. One is the creation of employment. So that will increase the livelihood security, and also on nutrition, reduction in poverty, positive impact on health education. Second one, when I talked to the NREGA workers, first thing they said is we have self-respect now. Because earlier we had to depend on the landlords and other, if there is a monopoly. Now we have another avenue. So there is a self-respect now for the workers. That's what they told me when I visited the sites. And third, of course, is the asset creation. It benefits agriculture, rural development, and environmental protection. Fourth is the impact on wages, because the agriculture wages, you must have seen, it has increased. Although when I was chairman of CICP, many of the farmers said that, you remove NREGA because it is increasing agriculture wages, because they have their own arguments. The fifth one, of course, impact on women empowerment, because 50% of the workers are women workers. And the sixth is helping the marginalized sections, because SC/STs, they are participating in a big way. And the seventh one is the reduction in distress migration. You can see in Mahbub Nagar or some other districts where the migration reduced because of this NREGA. And also seasonal benefits and insurance function, because even a small thing can devastate a small risk for a family comes, but a small help can help the family to sustain. The ninth one is the financial inclusion, which under the new government as Janadhan the program thing. The last one is the strengthening grassroots process of democracy, because of this scheme, this has improved. There are two extreme views on NREGA. One extreme view is it's a populist, it's a politically motivated, corruption, leakages, responsible for fiscal deficit, inflation and lower growth. So this is one extreme view which some pink newspapers generally bring out. The other extreme view is that everything is good about NREGA. So the truth lies somewhere in between, and it is essential to review ground level evidence, field studies on this. The field surveys, there have been thousands of studies on NREGA. It's the most researched scheme in the world as well as probably in India, because you can see any university, any research institute, they are working on NREGA. I mean, that is true of even American universities or UK universities. Many people have worked on this. So it's difficult to cover all this. So I've picked up very few. Even IPE might have done some work on NREGA. So I cover here in the next 15 minutes, so few studies and concentrate on the following. Income and livelihood security, what is the contribution? Second, impact on gender. Third, on child well-being. And fourth, on creation of assets. And fifth, on impact on migration. The impact on income, livelihoods, the macro level, if you see, the employment peaked in 2009-10. Then it declined. In recent years, there was a decline. And households were provided increased from employment about 21 million households to 55 million households. So around 5 crore households are being provided in recent years. But average percentage is about 46, and expenditure is about 39 to 40,000 crores. It's about 0.3 to 0.4% of GDP. So far, we have spent 1,80,000 crores on NREGA since 2006-07. And in spite of some leakages, studies have shown a positive impact on household income and health of the households. Income and livelihood security field studies, a study on 3 states show that share of NREGA income of the poor was highest in AP, about 17%, Rajasthan 10%, Maharashtra about 7%. Of course, several other studies have different shares in various states. But increase in the wages is modest contribution, because the recent studies, I think the Dilip Mukherjee has brought out, he says that rise of daily wages was 5 to 9% in different states. And different state studies have also shown positive effects on food and non-food. And the study by Drees and Ritika Khera showed that it's a lifeline for rural poor, because 70% of the households said it is helping them to avoid hunger. And also, it helped them in coping with illness. And also some other studies have shown that, NREGA, how it helped for families to avoid going hungry, sending children to school, and helping raising the market wages. If you see the expenditure of how much they got, the households in Bihar, how they were spent on several things. You can see the sum they have spent on the food mostly, and also other, even education and health, those things. So it has helped. Second one is impact on women and social group. One of the success of the is that participation of women. If you can see the, almost 53% participating, women in NREGA. And field surveys have revealed that NREGA's income in the total income in many states was 18% or so. And access to paid work has a positive impact on women's social and economic well-being. You can see the women's, how they are population of 1% of female sample workers collect their own wages, 79%, keep their own wages, 68%. So there is a women said that it has helped them. Women's contribution to household income, if you see, it is quite substantial in some states. So this is another contribution. And then impact on women and self-help social groups. If you see the SC and STs also, their proportion is much higher than their population share. Share of SC about 22%, ST about 17% are participating. So NREGA participation was about 40% of SC, ST. And also NREGA started this works on private lands of marginalized workers, that also helped the SC, STs. If you see NREGA laborers who are participating, mostly the poor and socially marginalized sections are participating. If you see the the surveys. And impact on social groups, 6 states field survey also shows the SC, ST, OBC, OC, the proportion of how they are represented, and also help them in sending children to school and other health benefits. And now the third one is the child well-being, because NREGA seems to have some positive impact on child well-being. Of course, women participation itself is impact on child well-being, that's important. But one of the gaps we found is that the care facilities at work sites are not there. So because if a woman wants to work, she has to keep children at the work site. So that is not found in many states. So that has impact on because otherwise the older child has to take care of the younger one. So that has impact on the child well-being. There are studies with the Young Lives data. The Young Lives is, the CES has been doing a lot of work with the Young Lives data. The Young Lives is in 4 countries, Ethiopia, Vietnam, Peru, and India. In this project, it started when I was in CES, 2002. There we selected 2,000 households in 1 year, those who are 1 year, and tracked them for the next 15 years. So I used to joke with Professor Galab, you can retire with this project. 15 years, you can track these people. And so we selected 1-year children and 7-year children. So we tracked them 15 years. So it gives a lot of data. And they did the baseline, and then every 3 years they are doing surveys. So based on that, they use this Young Lives data and see what is the impact on NREGA. So it showed that although some of the results are not robust, but it showed it had a severe impact on child labor reduction. And also a recent study by Burman, Galab, and Reddy showed that a lot of impact on human capital. The NREGA this paper uses a lot of work. So these are the results of this survey. It has improved the test scores and other kind of things. They use the 3 rounds of Young Lives data, and they find the program has no effect on enrollment, but has strong positive effect on grade progression and reading comprehension test scores. So this effect is similar to the effects of conditional cash transfers, like in Latin America we have. So the findings have important policy implications, because public works programs can be extremely beneficial to improving the children's human capital. The cost effectiveness also, many people say cost effectiveness of this program. It's wasting 0.3% of GDP, but they don't see these impacts of this. So the gains from receiving this program can be a very significant impact on this. And also they are critical. And fourth one is the impact on assets. Because there is a criticism nowadays, it's not contributing to the assets, but the evidence is mixed. In some places they created very quality assets,